My name's Sarah. I'm a nursing student, and at the end of last year, I discovered that I have Lyme disease. According to the Center for Disease Control, Lyme disease infects 300,000 people per year. It's the fastest growing vector-borne disease in the United States. Under their list of facts, the International Lyme and Associated Diseases Society, also known as ILADS, writes that 40% of Lyme patients end up with long-term health problems. The average patient sees 5 doctors over approximately 2 years before even being diagnosed. Well, now I bet you're wondering, what causes this Lyme disease anyways? It's a bacteria, a microorganism that can make you very sick. The type of bacteria that causes Lyme disease is called a spirochete. It's squiggly and coiled and moves by twisting around. I bet you're also wondering how you get that spirochete in your body. Well, when 2 ticks meet and fall in love, they mate on a large animal like a deer. The female tick will then fall off the deer to lay her eggs on the ground. Once the egg hatches, a baby tick comes out. This little tiny tick is known as a larva. The larva is hungry because it's growing and maturing. It needs blood to survive. It normally feeds on small rodents like the white-footed mouse. If this larva bites and then feeds from the blood of a mouse that is infected by the Lyme disease spirochete, then the larva gets the spirochete too. Our larva with the spirochete will eventually molt into a more mature form of a tick called a nymph. When our nymph infected with the Lyme disease bacteria gets hungry again, it may feed on the blood of a human if it gets the opportunity. This will pass on the spirochete bacteria to a person. In this case, the person was me. The greatest number of infections of Lyme disease occurs from the month of May in late spring into summer months and ends in the month of August in early fall. You may have heard that every single person that gets Lyme disease develops this bullseye rash. This rash is made up of circular red areas of skin that look like the bullseye on a dartboard. This is not true. According to ILADS, fewer than 50% of patients with Lyme disease recall any rash. Unfortunately, I was one of those patients. Like many people, I was diagnosed too late after the spirochetes had spread throughout my body. I didn't know I had Lyme disease. At first, my stomach started to hurt, so I was given medication for gastric reflux. I took pills for mental health issues after I struggled with depression and anxiety. My bladder then was always irritated, so I received medication for pelvic floor myalgia. I was prescribed inhalers for asthma and always had pain in my lungs. After continual high blood pressure, I received medication to lower it. Then my joints started aching and cracking with a lot of pain, especially in my spine. Next, my muscles started twitching frequently, and I would experience waves of panic, so my nervous system was involved. Worst of all, I felt like I always had the flu, with sore lymph nodes. It was really hard to function. But guess what? I'm one of the lucky ones. Some experienced life-threatening issues with their liver, kidneys, heart, and brain, much worse than what I have. Why didn't I just get some blood drawn so I could take a test and figure out I had Lyme? First of all, none of the specialists I saw recognized that I had Lyme. I was lucky to find someone eventually that put the pieces together for me, and I had a positive culture. Woohoo! The scary part is that many people don't test positive for Lyme, even when they have it. The most common test is called an ELISA. According to ILADS, the test misses 35% of culture-proven Lyme disease, giving it only 65% sensitivity. ILADS also notes that by definition, a screening test should have at least 95% sensitivity. Lyme disease, guys, It's a big mess. I've had to slow down my nursing studies and spend most of my time at home. Many people have to leave their jobs, go on disability. Some people lose the ability to walk. Others are hospitalized. A lot of us can't think or process information like we used to. And the hardest part is that treatment isn't a one-stop shop. You don't just take a few pills and you're better. There's no set treatment for late-stage Lyme disease. It's a real struggle. Also, an appointment with a Lyme-literate medical doctor is expensive. Testing and treatment can be expensive too. Insurance doesn't recognize chronic Lyme disease. They follow different guidelines, not the guidelines put out by ILADS. Depending on the state, doctors can get into trouble for helping people with Lyme disease, and many individuals have to pay out of pocket. I was lucky enough to get help from my family, but what about the people that can't afford it? What do they do? We need to band together to make our voices heard across all states. Use social media, use your camera. If you can, donate money. Encourage others to spread the message. We can't stop fighting. We have to help each other.